You are lying.
Your ankle.
Bug bites in
Flagstaff.
Flagstaff, and I couldn't stop itching them because I have a thing.
Glad that I had my Benadryl.
Yeah,
for you to use.
I have them other places like that one.
You're live in all the places.
Okay.
Sweet. I didn't get bit a single time.
Neither did
I got bit like 13 times.
Bailey didn't get bit either.
You guys went to
You weren't even with us.
You went to the dinner on the golf course.
She
That's why
was
you got bit.
It was the golf course dinner where we got bit.
It was like she was with us.
No, it was the golf
all
course
weekend.
dinner where we got annihilated by bugs.
Yeah, Daisy got some bug bites. I didn't though. I didn't get any.
So if somebody's watching this and it's been recorded, then they have to watch this whole part, right? Like when on the recording.
I mean,
one.
technically, I think they can fast forward, but why would you fast
Hey.
forward through this?
If you are watching this on YouTube, fast forward for about 8 minutes until we actually start this thing.
Don't fast forward. This is the good stuff.
Well, here's the problem.
You can't fast forward while it's live, though.
Right.
So
Yeah, no, they can't fast forward now when it's live, but if they're watching it, if you're not watching this on August 7th, 2026 at exactly 11:52 a.m. PST, then you're watching a recorded version. And we had patients tell us, we like to hear what you guys say and listen to like the pre-stuff.
Who makes squirt?
Are you
They're their own
doing
company.
like product placement?
Yeah, I really want to be sponsored.
We want to be sponsored by On Cloud Shoes.
Yeah, and
And
whoever
Squirt?
makes squirt.
If you're showing anything, show your shoes. I don't need y'all to be sponsored by a soda. There we go.
I have to sit up now. That's
And
the most.
who
That's
makes
the,
that?
the- I don't know. It says
Zero juice, a
DPS
1% juice.
G. I don't even know who that company that is. Whoever makes squirt, please sponsor me. Sponsor him.
Just sponsor
Oh,
me.
it's the Dr. Pepper 7-Up Corporation.
There you go. That makes Dr. Pepper DPS,
Oh,
Dr. Pepper 7 Up, DPSU.
what's G?
Gatorade.
Dr.
Gatorade.
Pepper
It's in Plano,
7
Texas.
Gators.
Oh, Texas.
That's where I told Colby to move to.
This has caffeine in it.
I have a question. Why the word demystifying?
Yeah, why demystifying,
Dr.
Dr. Emmett?
Because there's a lot of mysteries about bone graft. So
So what about debunking?
We could debunk something too.
You say demystifying every week, and we always giggle. So let's debunk something next.
Maybe Amelia says demystifying. All right, is
you
it me?
say it on our Instagram stories.
I'm just wondering if you just like that word.
Yeah, it's a big word. It makes you sound smart when you use big words.
What's the
So I
other
say
big word that you
demystify.
use all the time?
I use it all the time. Altruistic.
He's never
He's
used
never
that
used
word
that
in
word.
his life.
I
Nope.
use it all the time,
Until
probably.
the other day.
Never
It's
has
even
ever.
in a Taylor Swift song, and I had to
It
point that out the
is.
other day when
And it's a
people were like,
hero,
"You've never even
but-
said that word."
You came in and you were like, I use this word all the time. And I was like, okay, what is it? And you said to me, I was like, I've never heard you say that
I
word.
say that word so many times a
Yeah.
day.
And your wife laughed at you and was like, yeah.
I probably don't
he
say it every
never
day.
uses it.
That's probably true. I don't say it every
Wait,
day.
what does it mean?
It means
He does
being
know.
like stop. I know what it means. It
doesn't
means
even
yes, I
know.
do. It means so like if you do something like
Completely selfish.
I walked over to
Selfless.
McDonald's and got breakfast for you.
Mhm.
It wasn't altruistic though, because I got breakfast for me too. It's you do something for somebody, but you get something in return out of it. If you do something completely selfless, like
Then
completely
why
no,
don't you say it's a symbiotic relationship for me to go get Tiffany McDonald's?
don't bring up bigger words. Listen, I'm trying to explain one single word to
Simon
you.
King, you're both.
I know.
Oh yeah, we could sing Lion King. What?
You want to know something funny?
What?
You were like, "Oh, look how good a job I did. I got all the way through question 12." You missed the rest of the papers that were on the printer. There's 13 through 17 or whatever. 13 through 15.
Oh, well, I thought it was kind of weird. Or the risks of dental bone grafting.
There's the
No,
rest
no,
of
no.
the questions.
Is bone graft as strong as native bone? Not initially, but it will be. That's what it says. Not initially.
It's like we know this stuff.
It will be more stronger when it's done.
Yeah.
More stronger.
More stronger.
Okay, it's supposed to be
That's right.
111 today
Osseo
in Las
integrates.
Vegas. 111.
It's supposed to be really hot in St. George tomorrow too when I'm there.
You guys
so-
going up?
Yeah, we're gonna go up tonight. Daisy got a cute little happy bonus from her job yesterday.
Did
for
she really?
passing her inspection,
Oh my gosh.
and so she is finally gonna get her windows tinted, and she is so flipping happy
Actually,
about it.
I've heard about that.
Which is great because I got my car from the dealership with tinted windows.
And does hers have no tint? Is it here?
That my car's
Oh,
here.
your
So my
car's here.
car, yeah, her car has no tint. It
Like
has
just
zero
fishbowl.
tint. Yeah. So what's funny is I forget that when I'm driving her car. So I'll like mad mug somebody, and then they like look over at me. They're like, I'm like, no, I got this. It's fine.
Mine came tinted from the dealership.
I think yours did too.
Am
I
I?
think
Yeah,
Pearl. I think
yours
Pearl
came
came
tinted.
tinted from the.
It's
We
not
have
like-
to name Mark's truck. I've named pretty much every other vehicle in my life, and now we need to name Mark's truck.
We need to go
It's
look
a,
at it.
It's a Tundra.
It's a Tundra, but it
beautiful.
looks like
It's
cement.
with a little green
Little
undertone.
green cement.
hmm I'm gonna name it Rambo.
Mud.
Mud. That's
No,
so
it's
cute.
not brown mud.
I want to name it Rambo because it
Rambo's
looks
pretty
like
good.
it belongs out in the wilderness.
It's a pretty good name for that truck.
Why collagen specifically? Because collagen holds really
Okay,
good,
so
and then
now
it
if you
whispers.
have been fast forwarding and you stopped right now, there's still 2 minutes until we start this thing.
keep fast forwarding.
But we always go live a few minutes early. It gives people a chance to log in.
Where's the rest of the pages?
Oh, right here.
I already knew all this.
Yeah, I know. And it gives us a chance to do audio checks and video checks. When we first started doing these, we were
We were
like,
a little bit of a hot mess.
yeah, we'd start 10 minutes early and like 10 minutes late, we're still trying to get things figured out. But now Bailey is an expert and has it all handled every time. She's back there hiding behind the cameras. What you don't see is the amount of energy and effort and product placement. They're not going to sponsor you to buy Squirt or send us Squirt.
The red ruby one, please. It's
Yes.
my favorite.
But you don't get to see the behind the scenes. There's multiple cameras set up, and Bailey's been in here for a while getting it all ready to go. So thanks, Bailey.
Bailey, that's a new phone stand.
It's a new tripod.
Oh, a whole new
it's very
tripod.
Nice.
Our other one.
We're
was
getting
all-
fancy up in here.
This
The other
one's-
one was so ghetto.
This one's
It
carbon
was.
fiber and it's self-leveling, so I don't
Carbon
have to
fiber.
do anything.
Carbon
Seems
fiber
important.
and self-leveling.
That seems
Yeah.
really.
Wait, so if I kick it, will it self-level?
JMO, greetings from the runway in San Diego. Greetings on the runway.
She said SAN. Is that San Diego or
That's-
San Francisco?
Oh, I have no idea. Okay, watch.
If
This is
you're
what
in
we're supposed to
San
be able to do today.
Diego-
I'm supposed to be able to click on
You have
this,
to use your mouse.
comment, then everybody can see it on the
But
screen.
we have to do it way more gentle.
Yeah, I'll
so
do
we
it
can't
gentler than
shake
that.
The world.
Greetings from the runway in San Antonio. Andreas,
Oh, San Antonio, San Andreas,
Diego.
San Diego.
She'll
Do you know
answer in a
why
minute.
all
What?
of the
Diego. I
Yes!
was right.
Freaking love San
Got it.
Diego. Do you know why all the California coastline?
I knew because you already told me.
Oh, why they're all called San
Uh-huh.
whatever.
But maybe maybe the watchers today, maybe all 6 of them don't know.
So if you ever go to San Diego, you should do the trolley tour. They should sponsor me because I've been on that thing like 100 times.
you sponsor
uh,
them.
Yeah, I do. They each city that's like San Bernardino, San Francisco, is exactly 1 day's ride away from the next one if you were on horseback. And way back when the local priest or whatever was going to go, he went all the way up, and so it's Saint Diego.
Yeah, that sounds like
Bernardino.
BS to me.
It's real. You can on the trolley tour.
Just popping through on my way to Eugene, Oregon.
I was like, where's Eugene?
I got that one handled.
Eugene.
All right, 1 minute and we'll get started for everybody.
Eugene is not
Hey.
in Washington.
Never mind. I'll wait till this thing starts.
We'll just see her quietly.
No, we can still keep talking.
Your haircut does look really nice.
I was gonna bring up our haircuts, and then you
Oh.
just did it anyway.
It's
Well,
okay.
I was
well,
looking
it's
at the side of
12
your
now,
head.
so go ahead.
Okay.
I was looking at the side of your head and it looks really
So
nice.
at 7:00 this morning, because it's back to school week, so that's why barber can't get anybody in.
Oh.
He met me at the office, at the barbery,
That
the barber shop this morning at 7. I got a haircut because yesterday my beard was like this long.
Your beard was so long, especially last week when we were in Flagstaff. And you kept on
Crazy.
like pushing it out, and I was like, "You gotta stop doing that."
Since you guys saw us last, we went to Flagstaff.
Yeah.
And
For your band.
yeah, my band played in Flagstaff. It was a
awesome.
really good time.
It was awesome.
Really great show. What else has happened in the last 2 weeks?
Wait, can we do an introduction first?
Oh,
Oh yeah,
Like, introduce
hi, I'm
yourself.
Dr. Emmett, and I'm a 3-on-6 provider.
and I'm Tiffany Terry, and I'm Dr.
Lost
Emmett's
face.
assistant.
There you go.
Yeah, so we are a 3-on-6 office in Las Vegas.
Yep.
And at my office, at our office, this is all we do. We only do 3-on-6. If that somebody calls the office and asks for single implants, we don't even do that.
Oh,
We are
we
too
don't do
busy
them.
with 3-on-6. And so we do these live events every couple of weeks. We take a topic and we just discuss it for a solid hour. So we have a lot of content to talk about and explain bone grafting today. That's the topic. And then we also open this up for live questions. So if you have a question about bone grafting, I mean, that's on topic, so that'll be helpful. But if you have any
If
question,
it's not about bone grafting, that's okay. But
Yeah.
a lot of times our topics come from people asking questions in the 3-on-6 Facebook
yeah,
page.
asking us so many questions.
So there's lots of questions about bone grafting. So we're going to demystify,
Because that's a
or
word we
debunk.
use now, demystifying.
demystify.
But we're
bone
feeling
grafts.
great today. We're feeling super cute because we both got haircuts this morning.
Yeah.
Separate times, separate places.
Here's what's funny is you schedule your haircut like
Well, I
3
schedule on
days-
the wrong
3
day.
days before you want one.
Yeah, that's true.
I schedule mine 4 weeks in advance.
I
have
should do that.
I have a standing appointment every 4 weeks.
For some reason in my life, it's like a surprise. I wake up and I'm like, oh, I need a haircut.
You know what it is? I go, I get a haircut on Friday, and you go, I should get one.
Well, this time I looked in the mirror and I was like, who's that shaggy guy? Like my hair was so long and my beard was like a mile long.
Shaggy guy.
Okay, so without any further ado, let's talk about bone grafting.
Let's do it.
So I think,
What is bone?
yeah, we get a bone graft question at least once a week.
A lot of the time during consultations, patients will
lot during
ask about bone
consultations.
grafting, and
That's true. So let's just start with what is a bone graft. Take it away, Miss Tiffany Terry.
bone graft typically is when you have the tooth removed and you put in bone graft material, which could be cadaver bone or it can be what's called xenograft, which is primarily made of bovine bone. If you don't know what bovine is, it's cow bone.
What else could it be made out of?
Human. I said cadaver.
Yeah, could it be made out of pig bone?
Yes, but less frequently. They've
Mhm.
they've kind of gone away from the porcine, moved mostly into bovine. Or you could have is it allogen? What's the
Allograft?
one? Allograft,
Mhm.
where it's removed from your own
It's your own
jaw
bone.
and put back in.
Yeah. Can you
In
guys
case
hear
you guys could
Daisy
hear that.
sneezing in the background?
Bless you.
So bone graft in a regular setting would be, hey, the tooth was extracted. There's a hole there in the bone, and we want to predictably determine what grows back into that hole.
Yes.
So we fill it full of bone graft.
Mhm.
And what we're hoping for is that that bone graft will become, what's the word? I don't want to say innervated, not nerves, that it will be, have it in mind, like,
It'll
not osseointegrated.
It does kind of.
I'll think of the word in a minute. Anyway,
But it holds the structure of the where this tooth was removed, where the socket is. It's holding that structure
yeah.
instead of just collapsing in and becoming narrow and short.
And
It's
it,
holding the space.
the
It's-
bone graft itself provides a scaffold
Mhm.
for new bone growth to grow into that area and get blood supply and become new healthy bone that now belongs to the patient.
Yeah.
So the
yeah, we should probably every bone graft that's purchased from a reputable source. I won't go into the other ones, but it's bone that's been sterilized,
freeze
and
dried.
freeze dried. It goes through a very rigorous process of being cleaned, and then they add enzymes and peptides back into it, so that when your bone, like your body, sees it and just goes, "Oh, I just need to take that over," and
Yeah.
grows its own bone. I do that a lot during consultations, by the way.
So it's essentially just a scaffold. So
Yes.
if you
A
have,
matrix.
yeah, matrix. If you have a tooth extracted and you don't put anything back into the site, what will happen is the walls of the bone around will slowly cave in and you'll have a little defect where that tooth was. And we see this on x-rays all the time. We'll have a tooth here and a tooth here, the one that was extracted, and you get a dip down in the bone.
And three-dimensionally, you have bone on each side of the tooth, and then you get to that one, it's like, whoop,
Yeah, hardly any bone left.
no structure left.
So that means it's difficult to place implants. So if you're having a tooth extracted and you're thinking about getting implant in the future, oftentimes your dentist or your surgeon will do what they call socket preservation.
Mhm.
They will put something down inside of that extraction site to promote bone health and healing and bone height and width. So bone graft is the generalized term used for that. Now, bone graft can be used in other places. Where else do we put bone graft? We did one last week.
We do a sinus lift.
We do a
add
sinus
bone
lift.
graft into the sinus.
So
Very, very carefully.
yeah, very carefully. So patients will come in and they have inadequate height sometimes
Mhm.
back in the region of their top molars. And you can do a little sinus lift and you just kind of lift up the little membrane that's in there and pack bone inside of it, and that will heal really nicely. What else can you do with bone graft besides socket preservation?
Ridge augmentation.
Ridge
We
augmentation.
technically did a sinus lift and a ridge augmentation
the same patient.
On the same patient.
Yeah,
One on one side and one on the other.
that's
So
correct.
we didn't need to do the sinus lift on the side we thought we needed to. And so we moved to ridge augmentation.
So we can also take bone graft and we can build it up and pack it into where the defect is and get it nice and stable. And that bone graft will adhere to and become part of the patient. Now, how long does bone graft take to heal? And this is in the literature. And
Yeah.
I printed off the literature this time because I thought somebody's going to ask me like a real complicated question, and I better have the literature to support it. And I know you read through this and you have a photographic memory, so I'm going to let you say how long it takes.
Well, it depends on which
Here, I'll
type of
let you
graft.
cheat.
Yeah, type. Well, I don't. Yeah, depends on which type of graft. If it's a socket graft, so we take the tooth out, put the bone graft in, it typically takes 3 to 4 months to heal. If we are doing a ridge augmentation, so it's a big defect, we're having to fill the defect with bone and lay, membranes, which we'll talk about here in a second, over. It's going to take typically 6 to 9 months. We at our office, we always say 8 months. Lateral sinus lift, same, about 8 months. Well, 6 to 9, but at our office, we always shoot for 8 months.
Yeah, totally true. So the bone graft itself takes some time to heal. It's not a real immediate thing, but almost every single patient that gets a 3-on-6 gets bone graft. And you think, well, we took the teeth out, we put implants in. What are we doing with all the bone graft at that point?
Maintaining everything.
Yeah.
Your soft tissue likes to have bone. It needs bone to stay where it's at. So everywhere a tooth comes out, there's bone graft. Everywhere an implant goes in, there's bone graft.
Yep.
We do lots and lots of bone graft on our patients.
So
lots and lots of bone graft.
What is gap grafting? If somebody hears the term a gap graft, what does that mean?
So when you take a tooth out, you've got a socket like this. You're going to put an implant in there, but an implant's not that big. It's this big. So you're going to have a gap around the implant, and you pack bone graft down in there.
Yeah. So we gap graft. We graft around the gap between the bone and the implant.
I've explained that to a lot of doctors. It's really funny when I'm like, yeah, gap graft. And they're like, I don't know what that is. I'm like,
do more implants.
Don't worry. I got you.
We got you.
I will help.
Okay. And then another term you're going to hear almost at the same time as somebody talks about bone grafting is a membrane.
Mm-hmm.
So what is the point of a membrane? I'm going to talk about it first, and then let's talk about the different types of membranes.
Yeah.
So in your mouth, your soft tissue grows at a faster rate than the bone graft will heal. So let's say that we did a bone graft down inside of the bone, we pack it full of bone graft, and we just suture your gums over the top of it. Theoretically, your gums and your soft tissue could grow down in the extraction site and take over where the bone graft was, and it would just get the whole top part of it, even maybe the whole socket full of soft tissue instead of healthy, strong bone.
Before the bone has a chance to heal and harden.
Yeah. So we lay something between the soft tissue and over the bone graft, and that thing is called a membrane. What are the most common membranes made out of?
Collagen,
Okay.
PRF.
Yep.
Technically, pericardium is a type of membrane.
Of course.
I think those are used less often.
We have pericardium
We
here.
have pericardium.
So I want to know if every graft or is every membrane resorbable?
No, there's
No.
non-resorbable membranes.
So why would we
Yes.
want to use a resorbable membrane versus a non-resorbable membrane?
A resorbable membrane does not require any retrieval after healing, where
Yeah.
a non-resorbable membranes are used for kind of different, like we didn't place a lot of those when I worked in oral surgery. When we did place them, it was usually like a patient that had come in and had like cancer in their jaw.
Yeah, something else that we had
and
to
it
deal
was
with.
like you were dealing with a lot of defects. and
I
stuff
don't
like
even
that.
have. Do I even
So,
have one at the office? Do we have one maybe?
we have one. It's a sample. It's an rep brought us in one. It's a PTFE membrane.
Yeah, we use a ton of resorbable membranes. I mean,
Actually, we might have inked around with it one time. I don't think we
I
have it
don't know.
anymore.
so I don't
We
even
don't
use
have
them. We use sometimes 3 or 4 membranes per case. If we have a large bone graft that I'm worried that the soft tissue will grow in fast, we'll cover it with a membrane. Another thing that's evolving in dentistry and in healthcare globally is the use of a PRF plug. And a PRF plug, we're going to show some sample type stuff today and kind of walk through this, but PRF is a membrane that's made out of the patient's own blood. So it's accepted really well. It heals really well, but it also provides that little barrier between the soft tissue and the bone. So at this point, we already have some questions.
Yeah.
And Bailey's trying to get our attention to answer some questions. I'm supposed to be able to click on the screen today. Why don't you do it?
Because
Let's have Tiffany
so this
do it.
is
Okay, so let's click on that first one.
this. Oh, this is Curtis. Curtis.
Curtis from Kingman, it was great meeting you both yesterday. Here to learn some more. Cool.
Awesome.
Nice to meet you too.
Thanks, Curtis.
Thanks for stopping
It was
in.
He met you
Awesome.
yesterday.
Yeah,
Yeah,
drove in from
Awesome.
Kingman.
Yep.
Sweet.
It was awesome. All right. And then this is from David. I applaud you guys, transparency. Thank you.
Thanks.
Yeah.
We kind of just talk about stuff.
And we always tell people, if you don't like us, this
Isn't
is who
David
we
Copperfield a famous
are.
magician?
David Copperfield is, yeah, he has a show here in Vegas. For a
Isn't
long
his
time.
with a C?
Yes.
That's Copperfield with a K.
It is Copperfield. with a
Maybe
C.
that's part of the mystery.
Ooh.
Maybe this is the real David
This
Copperfield.
is the real David Copperfield, and he's incognito.
All right. Okay. Other questions we had submitted. So, what if you have a lot of bone infection? Can you?
Will you read their username as well? These are directly from your Facebook post.
Oh.
where you asked for
Sorry. Okay.
questions.
This is from Teresa Nichols. Hi, Teresa.
Hi, Teresa.
What if you have a lot of bone infection? Can you still get a bone graft? Yes,
Bone infection.
bone infection. But the key thing here is we have to remove all the infection.
Yes.
So if you have a big infection, you just pop the tooth out and you don't go in and debride the area, which means clean out
Everything
all
else.
the infection, then it's contraindicated to put bone graft into that site. However, during the 3-on-6 surgery, we open up your gums all the way across.
Everything.
And our case that we did Wednesday of this week,
Mhm.
we had copious amounts of infection.
Quite a bit.
And we cleaned it all out. We removed it all. We got down to good, clean bone. And then we filled those things full of bone graft.
Mhm.
He has a very large bone graft on his lower left.
Yes, he has.
And we covered that with a membrane. So he has large bone graft, the membrane sitting over the top of it, then a bridge sitting over on the top of that. And then it's all sutured nice and shut.
In his situation, he has PRF membranes.
That's
So
true.
He has the type of membrane that's made out of his own blood and platelet rich fiber, but
Yeah.
blood and all that stuff.
I will tell you right now that I don't ever want to use the term every because that just doesn't always work. But by far the vast majority, most patients get bone grafting done during surgery for a 3-on-6. And I will tell you that most patients have some degree of active or recent infection, even if it's just heavy amounts of inflammation. But Teresa, having bone infection is common and it's dealt with during the 3-on-6 procedure every single day.
Yeah,
So
for
good
sure.
question. Candy Johnson, how do you actually do bone grafts?
Where does the bone come from? So we
Where
kind
does the
of
bone
talked
come from?
about where the bone comes from. So I'm actually going to show you
How do you
guys
do bone grafts?
how do you do bone graft.
Let's show a bone graft right now. So let's show what it looks like.
So this is what one of our boxes of bone graft looks like.
One of the many different
If-
kinds.
If Geishlik wants to sponsor
Oh yeah,
us,
Geishlik will sponsor me. This little
that
box
would,
of
that
bone
would
right here.
save so much money if Geishlik would
So
sponsor.
this little box of bone, just for comparative, is this 1 cc?
This is a 2cc.
So this is a
this
2cc.
is a $350 box of bone graft.
Yeah,
And we'll go
$300.
through 2 to 4 boxes of bone graft per patient.
So do the math. This stuff
Plus
is
the
not
other
cheap.
Stuff. Yeah.
But look
this
at how
is-
pathetic this is. This is how much bone graft comes inside of there.
So this is 2 cc's of bone. Now this is a bone. This is what's a bone supplement or substitute supplement.
Supplement.
Substitute. So
Vitamin
this is
C.
a xenograft bone graft. So this is
What does that mean? Remind me.
bovine.
Okay.
So this would be sterilized, freeze dried cow bone.
And you can see it looks kind of like sand.
Yep.
You can see the little particles
tiny particles.
inside.
Cute.
That is 2 cc's of bovine bone
I did not
graft.
bring any human bone in. I didn't bring any
That's
cadaver
right.
bone. But it looks the exact same. The jar just looks different.
Yeah.
That's it.
So that is prepared, ready to go bone graft. Now, we don't just put bone graft. We don't just like pour this in your
Pour this
mouth.
in.
That was ridiculous. We
And
need to.
Very hard to do.
We need to. So this is going to answer the question: how do you do it? How do you actually do bone grafts?
So step one at our office is we have Mark, our wonderful anesthesiologist, pull up a bunch of blood. from
Describe
you.
a bunch. How much is a bunch?
We get
6.
6 of these and one that has a white cap on it for a different thing.
For
But,
some- yeah.
yeah. we
So
get 6
how
of
many
these.
milliliters of blood is this?
Oh, I don't even
10.
know. I was just like, I don't even know.
So that's 10 cc's or
We
10.
usually only put like 6 in each one though.
Well, he underfills them a little bit.
Yeah.
So we draw the blood.
Instagrams can see that.
If you're having a 3-on-6 surgery, we do it while you're asleep.
Yeah.
Our goal when you have surgery, we start an IV and get you to sleep as soon as possible. And then while you're asleep, then Mark will draw the blood.
Our patient was so nervous on Wednesday. We normally go in and like ask him some questions. And we went walking in and Mark was like, he was so nervous. He's already out.
He's
We're
going
like,
to sleep.
perfect. We all knew who he was and what we were doing, but he
So
was so tired. He
we
was
get-
so scared.
6 of these filled up.
Yep.
We put them in a centrifuge. They
which is a
sit.
fancy machine that just spins at a certain rate and separates all the happy healing properties from your red blood cells. And that is the PRF that is floats to the top.
And it makes like a bright yellow, I call it a snot clot. and
Or a
people hate
golden
it.
gummy bear.
golden
and then
gummy
I can't
bear.
eat golden gummy bears.
So it makes a little clot, and then we take that little clot out, we remove the red from it, and now we can do many things with this PRP.
It's
This
all
PRF,
it's
excuse
all
me.
the super happy
Healing properties.
yeah, rich healing properties that are in your blood.
Platelet-rich plasma.
Yes.
So we can take these little gummy bears, and one thing we do to make bone graft is we mince it.
Yeah.
So I'll take a few of those and put them into, actually, let's show them what that looks like. So
I'm
I'll
actually going to open this. I'm
That's
like,
fine.
gonna be like, stop opening
Stop
things
opening
I have
things.
to sterilize.
So we're going to take a couple of these little gummy bears, and we're going to put them down inside of a little cup, and I'm going to mince it with some sterile scissors and cut it into little teeny pieces. There's my special
Cute
scissors.
And
And
it goes in this cute little bowl.
goes in there.
Cute. So normally when we do a full upper and lower 3 on 6, this is typically about halfway full.
Yeah.
About halfway full usually.
A bone graft and
Bone graft and then the PRP and the PRF.
PRF.
Mhm.
So we mince it into little teeny pieces, and then we
Mhm.
pour the bone graft into it. We mix it thoroughly, and then we add on a little bit of PRP, which remember we said we had a white cap, one of those things?
Yep.
That's to make PRP. We just spin it in the centrifuge for less time.
It's just a runny version
Yeah, it's just
of the golden
runnier.
gummy bear.
And then what it does is it sets it up into almost like a Jello consistency.
Ooh, there's lots of people that are having PRP facials right now, where they will actually do blood,
Pull the blood, and then
Yep.
it's called a
Yep.
vampire facial.
Vampire
and they'll
facial.
inject it back
Yep.
into your face.
Somehow
It adds-
they renamed it from vampire because
Oh,
that
really?
was scaring people.
It
So
scares
they
me
call
now
it
just to think about
PRP.
Hey, as a side note, every time we open something up in our sterilization packets, there's one of these.
Yeah, if
And
we could be sponsored by 3M, that would be
this
really
is just
helpful.
one more way that we verify
that it's been
that everything's been sterilized. This little black line will go from red to green to tell us it's okay. So every packet, every cycle, we
Every
run a
single
spore
packet.
test.
Yep.
Every packet has its own little thing in there. Anyway, side note. So now we have this
So
stuff.
you know it's sterile.
Yeah, so we know it's
Mhm.
clean. So now we have this Jello stuff with the bone particles kind of suspended in the gelatin.
Jello.
All right.
Perfect.
And
And, then,
then-
I take this cute little scooper.
She scoops it up with this.
I don't know how to make it so that you can
Here,
see
I'll
it.
put my hand.
behind
Oh,
it.
there we go.
Cute little scooper. And then I pick up little bits of the bone graft. We'll show the
Little bits at a time.
Instagrams.
And then we put that, she'll kind of set it right by where we want to pack the bone graft into the gap grafting and into the extraction sites
Into the sockets.
or into the ridge augmentation.
I literally just scoop it up and then I hold it right where we need to. And then that dude,
And then I slide it off of this and pack it down in there. So this is just a little
little bone packer. Other way. There we go.
packer.
Isn't
It's
it
got
cute?
different sized ends on it.
Okay, that's the one that's in
a
our
little
bone
one.
graft kit. We do have a smaller one that's in one of our surgical kit. But
And we can use that to pack the bone down inside. And you're not packing it like, I always say amalgam. Nobody knows what amalgam is. You're not packing it like really, really hard.
yeah,
You're just packing it down inside.
until when you push on it, it doesn't continue.
Doesn't
to
go anywhere.
collapse. Yeah.
And then really the very best packer in the world is your finger.
Mhm.
So she'll set some on the top and I'll start to push, like especially
Yeah.
in big defects or in big
Mhm.
extraction sites, you can just pack it right down with your finger. Because the PRP has a little, it has a lot, I don't know what they said. I'll look at it in a second. I'm going to get made fun of right now. And you pack it down inside there, but because the PRP is kind of like gelatin a little bit, it squishes a little
Yeah.
and it allows itself to kind of pack down inside there. Now we used PRF when we were doing wisdom teeth.
Mhm, we use
And
PRF every single case.
Every case. We never had a dry socket out of
Ever.
thousands of teeth.
We used to knock on wood when we said that, but we
We never
we don't
had.
need to anymore.
And it's interesting to me how many patients come in after their 3-on-6 surgery and like, I had no pain. This hurts way less than having a single tooth extracted. You took out 13 teeth and put in implants. How is this possible? But the PRF, I think, makes a big difference in your healing.
Yeah, absolutely.
The other thing I do is I take the PRP at the conclusion of surgery,
Mhm.
whatever's left, and I just
Put it all over the
squirt it
gums.
all around
Yep.
your gums.
A couple weeks ago, you actually injected it.
We
up
injected it into a
underneath
few
the
places.
Soft tissue, and I was like, "Oh, that's
That's
a
pretty
fancy
great.
way of doing that." Yeah.
Okay, so I'm getting a look from Bailey. It's time to do some questions again. All right.
Have
All right.
Tiffany click on
Okay, we'll
All
catch
right,
up on questions.
so let's
How
go
far
through.
was
We
it?
already talked about
David Copperfield.
David Copperfield. So we're gonna go to this one right here. This is
Yeah.
Elise Sears.
I want to use only my own parts, tissue if possible. Thanks for doing this live. Hey, cool. We can totally do that. So, Alice, if I butcher your name, Elise,
You guys are-
I'm doing my best. Mrs. Sears,
I'm trying my
best
best,
mama,
honey.
honey.
Oh, I miss it.
So we can totally do that. So there's many different ways to harvest the bone from the patient. The most, the least invasive is the little bone scraper.
Mhm.
And we just scrape it along the areas in your mouth where you have excessive amounts of bone.
Usually on your lower jaw, way back,
Mhm.
way back far.
And that will kind of let us scoop up the bone.
Mhm.
There's also some areas where we can harvest bone sometimes, like your palatal or your lingual tori in your mouth. If you have some of those areas, we can use that bone to put in there. So yeah, that's totally a possible thing to do.
To do a full mouth just with that
Would be
maybe a little tricky.
pretty
just 'cause that's a
excessive.
lot. Yeah, it's quite a bit. But if you're worried about it being cadaver bone, you do have the option of just doing the xenograft or the bovine. We had a patient recently that's like, I don't want any
Yeah.
cadaver. We just do
Yeah.
xenograft on her.
And remember,
and she's healing great.
it's not, it's just a scaffolding.
Mhm.
It's just that it's shaped the right way and it's very porous material, but it's going to turn over into your own bone anyway.
Yeah.
So even if you had just the scaffolding, it's sterile, it's freeze dried. You're not getting any proteins or enzymes from the animal.
I've worked in dentistry for 15 years. I've used bone graft for
15
15 years. I have never even heard of a recall on bone graft.
Yet we track it
We track
single
everything,
time.
every lot number. And then she followed up with, wow, I'm glad to know it's not cadaver bone from humans. It can be, but we've gone over that. This is the doctor I wish I could have.
You can have me.
You can have him. Call the office,
Yeah, come to Vegas.
702-710-9006.
Alice Sears, you can have us.
We'll tell you. And then we got a
Hi,
cool.
cool. Ooh.
I wanted to see what this one said. Love your content. Finger.
with the number one emoji.
Oh, that's what it is.
I was like, that's awesome. I
I
love
thought I
it.
get made fun of for
Yeah,
using my fingers
yeah.
as bone packers.
Alice is right. Okay, Alice. Well, I'm glad that we didn't mess with you.
Yeah,
So,
all right.
yeah.
Perfect.
Adding
Alice.
letters that didn't need to be there.
It's good that you're here to read names.
Yes.
Okay.
Got it.
That's all of them.
Okay.
Perfect.
So let's go back to another question. We're
Okay.
we're only 25 minutes in. We're doing good. Okay. This is from Tanya Ray. Miss Tanya Ray.
I'll just hold this up while you
I would appreciate information regarding bone grafts and sinus lifts success rates.
Let's talk about it.
All right. So I have a tendency to underdeliver or no, undersell and overdeliver.
Over deliver and under
Under promise and over deliver. We both said that backwards.
Listen, it's been
listen.
a long week, everybody.
I under promise and over deliver. So when I talk about success rates of certain things, sometimes I will tell a patient the worst success rate, worst case scenario success rate. But I
In
printed
reality-
off the success rates because I wanted to answer Tanya Ray's question specifically with all the right information. And I was actually pleased to find this out.
It'll be in there.
I
and
know
it
it's
will
going to be
in-
number
Do you want me to tell you what
7.
it is?
Yeah, you can
It's
just say.
95 to 98.
Yeah. Well,
Sorry, he made me go through this and look, it's 95 to 98.
yeah.
Oh, Santa slipped on.
The practical figure that you can use is these have a success rate, 95 to 98%. So they have a 90% success rate is how I look at it. They really have a good success rate. Now you have to keep in mind how we measure success might be a little bit different.
Right.
Do we measure success by I stacked the bone this tall and I didn't lose any at all? If I stacked the bone this tall and I only lost this much, is that still successful?
Absolutely.
Absolutely. So in our practice, in my practice, and the way I was taught was we overfill by 20%. So if I am doing bone grafting, I'm traditionally using more than I need. I'm overfilling and I'm allowing for some compaction,
Shrinkage.
some shrinkage, some loss of that bone graft over time while it's healing. But they have a very, very high success rate. Now there's different types of bone grafting that we have to talk about now because ridge augmentations, the larger the ridge augmentation is, the lower success rate.
Correct.
And they can be as low as 60%. So in just a general sense, traditional bone grafting, very high success rate. The more complicated and the larger the graft and the more challenging the case, then the success rates can actually go down from there.
Which I think is true in any.
Yeah, kind of with everything.
Yeah.
Okay, length of success rate in times. Listen, once this bone has turned over and become your bone, takes 6 to 8 months, it's your bone. So it's not going anywhere if we don't do anything to cause it to go somewhere.
Yeah. Well, interestingly enough, most of the studies that you look at that talk about bone grafting or implants or any of that, they follow it for a 10-year cycle.
Yeah, that's what a lot of these research papers
it's a 10-year cycle. That's how long you have to follow it to get it published and all that stuff. So
yeah.
So in 10 years, how much of it goes away? It's still technically successful if it's still there.
Yeah.
So,
Good point. Okay, when someone has periodontal disease, also, what does the recovery look like?
Almost all of our 3-on-6 patients have some level of periodontal
Guys, everybody
disease.
has periodontal disease.
Yeah.
Everybody has some degree of
Everybody
it.
has some degree of periodontal disease.
By the time you've got to the point where you need full mouth reconstruction, the exception to that would be if you're already in full mouth dentures. Pretty uncommon to have periodontal disease.
Unless you don't take your denture.
Yeah, not unheard of, but really uncommon. So, yeah,
that doesn't disqualify you from a bone graft.
Yeah, most patients have some degree of periodontal disease, all the way from minimal to severe.
Severe.
We see severe periodontal disease all the time. The advantage of the 3-on-6, we talk about this in several of our videos, is we open your gums all the way.
Eradicate it all in one day.
Yeah, we take it all out during one surgery. So you wake up without periodontal disease. We literally remove it from your gum tissue. We remove it from the bone. We're not cleaning around each little tooth and trying to dig deep and try to get to
The
it.
teeth are gone. Yeah,
We just
we've
open
taken
it
the
up and
teeth
remove
out, Put the
So
yes,
yeah.
Bailey's
We got
raising
it.
her hand.
We got it.
Bailey raised her hand
We got
like we're
it.
in school. All right.
Instagram
Bailey has a
comment.
I was
question.
gonna say it's the teaching degree in her.
Yes, Bailey?
Instagram comment says hello from Boston, and it's
Oh,
Alex.
Dr. Fedorenko.
Yes.
Dr. Fedorenko.
Hi, Dr. Fedorenko.
Well, hello, Dr. Fedorenko.
I can't remember.
Alex,
how
nice to see you.
that's-
Okay,
Dr. Fedorenko.
we have
he was,
some
he hung out with us
a couple years ago
a
in
gajillion
Mexico.
years ago, and
Oh,
and
we
a
did.
gajillion years ago in Salt Lake when we did
Gajillion.
the training.
Okay, so we have shown a bone graft.
Yes.
Can we show the membrane at all?
Yes.
Can we open that?
I'm gonna open it.
I'm afraid it's in like a
That's
completely
bone graft. Let's
white
open
package,
these.
though, isn't it? Is this
That's
one
why I
that's
grabbed
clear?
this one.
Is
I
that one
believe
clear?
it's the clear one.
Okay. So I want to show you guys what a collagen
I got it right.
membrane looks like, so you have some context to that.
Once
Now
again,
remember, this is resorbable.
Yes.
This will resorb.
this is a
on its own.
resorbable bi-layer collagen.
Does
which
not
means
need
it's
to be
made of
removed
2
later.
layers. So it's that little white guy right there at the bottom. See if I can turn it and it will move. That guy.
Yeah.
That
They're
is
usually
a
like
collagen membrane.
1.5 millimeters thick.
Yeah,
They're not
pretty.
real thick.
I don't know if I can show you how thin it is. Not really.
Paper thin.
Yeah, they're paper thin, but they
We should have
don't
Bailey
just,
show that to him on.
They don't just fall apart.
They have some
like-
rigidity to
yeah,
them.
they
They have
have
some
some
structure.
rigidity.
Yeah.
There's a couple different kinds that are like almost stretchy. We like those ones.
I do like those ones
You
a
do
lot.
like those ones. I got these ones for free because I ordered lots of bone graft though. So.
We do order lots of bone graft. We order bone graft in like $4,000 and $5,000 orders per time.
Yes,
As
and
we go
this
through a
is
lot of
this is a 13 by 25
Oh yeah,
millimeter.
guys, they measure this stuff out in,
In
millimeters.
millimeters.
So you can order very, very small membranes, very, very, well, the largest like a 20 by 30,
Yeah.
20 by 30
Yeah, some
millimeter,
companies have a 40 by 40, and
which is humongous.
So
I don't even know where you'd put that.
You said it looks like a nicotine pouch.
it does look like a nicotine
Which
pouch.
is helpful.
Yeah, it
Yeah.
does look like a nicotine pouch.
That's actually
The
hilarious.
difference is this says up. I don't know if you guys can see it or not. Oh, you can right there in the upper corner. See where it says up? That's the side that
Tells
goes
you which
up,
direction.
which
you
is
should go.
all fun and games until you place it in the site, and then you have to take it
I have
out,
to try to remember
and then you have to
which
remember
one
which
was
side
what.
was up.
Okay, so
we have a trick.
we're exactly 30 minutes through right now. If somebody wanted to get in touch with us, Tiffany, how would they
Can't
do
lose the
that?
Stickers.
Okay, don't lose those. So we're gonna tell you how
You're
to
gonna-
get in touch with us
You're
right
gonna
here.
call the office at
Call the office.
702-710-9006 or follow us on here anyway.
Yeah, follow us there
Follow
anyway.
us here anyway.
Bailey
Even if you don't
really
need
wants
us,
you to follow us
here
there.
anyway.
Guys, our content, this just barely
Yeah.
hit 4.4 million
Million
views on
views.
YouTube. We have almost 800 videos on YouTube now, you guys.
Dr.
So,
Emett said, "Don't they start paying us at some point?" I said, "Did you not get your $2.13 check?"
yeah, I've received
What?
$0 from
Yeah,
YouTube.
yeah. But you can go to our website, alloutdental.com. There's a little form that you can fill out on there. If you don't want to call us, we will call you and send you a text message.
But not like salespeople.
No. Oh my
Not
gosh.
that way.
We are not salespeople. If you want a salespeople office, not ours.
We're the wrong one. Okay, so we're going to transition now to just answering all of the pre-submitted questions and opening up the call to ask all of your questions. So we're going to start with the ones that have been asked just recently, and we'll kind of work our way through. You missed this one. You got to get up to
Start with
Rook. So if you have a question, there's no bad or dumb question. Submit it, and we'll be happy to answer it for you. And then we have pages of other questions to answer right now too. So let's start with these. Because of cost,
would it be possible to do? Sorry. I do that
Let's
to you
take
all
turns.
the
You always read
time.
over
I
it.
do
Okay.
that to you all the time.
I'll read this one.
So
You can do
sorry.
the next one.
Okay, sounds good.
Because of cost, would it be possible to do bottom first and then top later, or should both top and bottom be done at once? Tiffany, in the last 3 years, how many patients have we helped where we did just one arch or the other? Seven total.
That being said, though, we have 4
Coming up.
scheduled over the next 2 months.
Yeah.
So is it possible? Yes.
Yeah. What makes it less possible?
It all depends on the stability of the opposing teeth.
Mhm.
So let's say it's your lower that you're missing a lot, or you have a lot of work that needs to be done. You don't want to go through all that work because you know you're going to replace them. If your upper teeth are stable enough to handle the lower being super, super strong, then yes, you can technically put that off. However, that's not always the case.
So I'm going to go into some technicalities now
It's
since
not
you
always
asked
the
it.
case.
You're getting the technical answer.
I mean, this is
Rook.
all we do, and by the end of what's currently scheduled, we'll have done
12 total.
11.
If
12.
I am limited to one arch, that means we're constricted by the opposing arch. So if your teeth and most people just want to do the top, just do my top
very
teeth.
frequently.
And your bottom teeth look like this, and
Coaster.
it's a roller coaster, and you've got fillings, and you've got stuff going on, and they're breaking down, or maybe some missing teeth. I have to match your big, beautiful new top teeth to your bottom teeth so you can chew.
Mm-hmm.
So I'm also constricted in this dimension. So I need your top teeth to overlap your bottom teeth slightly. So if your bottom teeth are back here on the ridge, I got to put your top teeth back here. If your bottom teeth are clear out here on the ridge, I have to put your top teeth clear out here.
Mm-hmm.
So if I do them both at the same time, I have complete autonomy and control over the cosmetic and functionality of your teeth. Yeah. So I do understand this is expensive. That's not lost on us, right?
Absolutely.
Because of cost.
Yeah.
But I also tell patients all the time, if it's worth doing, it's worth doing right. The other thing is one surgery, one recovery is pretty sweet.
Yeah.
So every patient who I've ever done a single arch for, I tell them the same thing. If we decide to go back in the future and do the other arch, and you're going to call me in a year and say, all right, I want my bottom teeth done now, there is a high probability we will have to redo the upper bridges, not the implants, but we'd have to redo the upper bridges because the upper bridges were made to match your bottom teeth.
Lower.
But if we're going to redo your bottoms, let's redo the top and make it ideal now. Yes. So we have a lot more control and flexibility and freedom and autonomy for an outcome when we do them both together. But it is potentially possible to do one at a time.
So in the long run, doing them separately will actually end up costing more than it will be to just wait. Not every patient can wait,
right?
But talk to your provider and see if that's possible.
Just know those are the things to consider.
If you're looking for a provider, come to this
Introduce us. Come see us.
To this guy.
Hey, if you had to have all of your bridges on an arch replaced, how much does it cost?
Right now, it's about $3,000.
So it's not like it's $20,000. It's $3,000. You replace all the bridges, which can be a big deal, but just keep it in perspective.
Alice says, "Thank you so much for this slide. You two are amazing." Yes.
Thanks, Alice. All right.
Love it. I tried to.
It's our haircuts.
I tried to give Daisy a high five in the car this morning. She's like, and I'm like, never mind. It's all good. All right. So then we're going to go down. Daisy said it looks like a nicotine patch. It does look like a nicotine patch.
Okay, you're going to read this one.
Let's go
I'm not going to read over
Sue.
you like you do to me. You can just read it on your own.
All the time, too.
Go ahead.
If a patient has a lot of bone loss, perhaps lower molars on one side have been gone for many years, what extra considerations or procedures would you need to do if easy enough to describe? Thanks.
Hi, Sue.
Yeah, hi Sue. We had this conversation with a patient really recently, actually.
You deal with this every day.
Yeah, she's been missing her lower right molars for, she said, as long as I've been alive. I'm 33, so for a while. And it's just in the implant placement. In her case, she's not going to get an implant straight up and down. She's going to get an implant that's angled forward. She's still going to get bone graft out there. Like, she still will have lots and lots of bone graft in that area to help rebuild this dimension of the ridge so that the soft tissue is happy. But her implants are just not going to be vertical. They're just going to be
So
at an angle.
when we've lost molars and the bone gets thin in that region, there's some risks depending on the arch. If it's the upper arch, the space between inside your mouth and your sinus gets really small. So there may not be an adequate bone height for an implant. So we get tricky. We angle one forward, or we angle one all the way back here and go into a specialized piece of bone back here called the pterygoid. If it's on
I think we've done a live about pterygoid.
Yeah.
Have we?
the whole thing.
Find that live on YouTube.
If it's on your lower arch, down inside of your jawbone is a nerve that runs right along your jaw and comes out a hole here on your chin. And so we have to stay away from that nerve. And some people's jawbone gets so narrow down there that it's right on top of that nerve. There's just hardly any space. So we have to get tricky. We have to angle an implant forward. But I have never in my entire career had to go in and do a ridge augmentation prior to 3-on-6 surgery on the lower.
On the lower.
Yep, never had to do it.
Yep.
So we almost always can find adequate bone and angulation to avoid having to do excessive augmentations on the lower arch. All right, good question.
Hope that answered your question, Sue.
Good question, Sue.
And Daisy said,
Next
I
one.
love the new bubbles with the questions. It makes it easy to stay on track.
Oh, well, put it up there so people can see it then. You can't just read it anyway. I have to read this one because you got to read the last one. I love the new bubbles with the questions. It makes it so easy to stay on track. You're welcome, Daisy.
You're welcome, Daisy.
All right.
All right.
Here
And
are
then we
daisies.
got,
You have to click on the same one again.
no, you can click on the
Oh.
next one. Brooke says, thank you so much for answering my question.
You're welcome.
So welcome.
No problem.
Just get another one.
We did.
Yeah.
What is the thickest? Oh, sorry, guys.
What-
I'm shaking the whole world when I do
What is the
this.
thickness difference between normal teeth and final bridges?
As close to identical as possible.
At Freon Leon,
Bailey, we had me
I
the.
can reach it.
Yeah, all right.
we have me the All-in-X model. So we have entire videos, like multiple
we do.
podcasts
Yes,
and,
we do.
and videos about this.
So many on our Instagram and yeah.
At Freon Leon, there are different dimensions of
I hope he does air conditioning.
I hope so too. Different dimensions of thickness.
Mhm.
There's the height thickness, and then there's the thickness front to back,
The width.
the width. So I'm going to show you a very, very good all-on-X.
This is the one with the fake gums.
In fact, I'll show you a bad all-on-X too if you want to see one. There's a really good all-on-X, and you can see it's really thick in this dimension. It's also really thick in this dimension, right? You have all of the fake gums and all of that material there. So a all-on-X is very thick.
Show the Instagram.
Dun, dun, dun. Oh,
It's okay, they can see it.
can they see
Yeah.
that one?
Okay.
All right. Introducing
The 3-on-6.
3-on-6.
All right, so we'll do this direction first.
They're the
fancy.
same width as
As
your
your teeth.
natural teeth. In fact, we gave a guy his finals yesterday, and he was
He
like,
cheated too.
"Oh,
He immediately started licking
they
them.
feel like my
He's
teeth. They're the same size as my regular teeth."
We gave someone their finals on Monday, and we went
Yeah,
from
we
her
did.
second attempt to her finals, and she was like, I wasn't sure because my second attempt still felt a little thick.
I could still feel the little bump where the
But-
screw was.
Yeah, but this is so much better. So yeah, so that's the thickness of a 3-on-6, and then there is from the front view.
Our goal, Freon Leon, is to, I just want to keep saying his
I
name.
know
It's fun.
Freon Leon.
So Freon
It's
Leon,
very clever. It's very clever.
our goal is to make the teeth the exact same size as your natural teeth.
If
They don't
that's
have to
what
look
you
the
Yeah,
want.
if
Yeah.
that's what you want,
They
right?
don't have to look the same, but as far as the dimensions of width where your tongue is going to be
Mhm.
bothered if they're thick,
That's why my
Oh,
patients
the
don't have
time.
lisps,
Yeah.
because it's the same as they were used to.
yeah, the time and effort that Dr. Emmett puts into trying to shrink that down, I would argue is more than most doctors.
It can be more than a lot of the procedures sometimes, is the
Yeah.
pre-planning and the post-planning and the designing And shout out to the lab too, because
Yeah,
I'll
they
spend
know sound
hours
systems.
with the lab going over cases to get it tooth by tooth
Uh-huh.
to get them as thin as possible.
And during the actual surgery, after we send all the scans and everything, big shout out to Mallory. Mallory is always,
Mallory at the lab.
at Mallory at Smile Systems Lab. She is always so good. She won't continue with the design until she knows that the implants look good because she knows how you want
She
them.
knows we are so picky
Yeah.
about every angle.
Yep. She's like, everything aligned, it looks great. And then she'll send a message about 5 minutes later and be like, implant placement is great. I'm going to proceed. Like,
Or
thank
she'll
you,
say,
Mallory.
hey,
yeah, hey,
do you want to take a look at this? And
Yeah.
I will literally stop a surgery
Mhm.
and redo the abutments
Mhm.
and change out abutments and change angulation, because in the very beginning,
Thin. Yeah.
I didn't do that. And I had a few patients, we got them the thinner abutments
In the end.
in the end,
Right.
but they had to go for the entire 4 months with a pretty thick area or thick tooth. And I would just rather take the time during surgery to get it
Mhm.
right. I'm kind of a perfectionist.
Kind of.
Yeah. So yeah, Freon Leon,
It's his middle name.
we want.
Leon does do HVAC. By the way.
Yes, I
That
love
was
it.
perfect.
I
So
love
yeah,
it.
we want it to be the same size.
so clever. right, Mia, huh?
Is it your turn? Your turn. You were
If I only need a couple extractions before I am ready for 3-on-6 surgery, still saving the money, should I have that dentist place bone grafts? Yes.
Yeah.
Absolutely.
It costs some more money,
Yes.
but you want, first off, I want to do it.
Yeah.
If I'm going to be doing your 3-on-6 surgery, I want to do your extractions. There
Yes.
are certain extraction techniques that we use for 3-on-6. We use atraumatic extractions. We preserve buccal plate. We do special types of socket shielding and ways we extract in the canine eminence. There's all these things that we want to consider in the beginning for your final outcome.
Yeah.
So in a perfect world, and you want extractions done before we do your surgery, let me do them.
Yeah.
But if that's not the case, tell the provider doing your extractions, hey, I need socket preservation.
I need socket preservation and I need ridge or socket
Atraumatic
extractions
and
Thank you.
socket
What's the word I'm
preservation.
looking for? Yeah.
And you do want to get the bone graft. Have them put bone grafting in and put a membrane over the top of that. Get really good primary closure, tension-free primary closure over your membrane.
Mhm.
It's kind of technical, it's a little complicated, but I believe any highly trained provider that's taking out teeth and doing bone grafts could do
do
a good job.
Yeah.
And they could always call me and I could talk to them. Good question, Mia.
Cool.
Free only on. Thanks. Yes, I do HVAC.
Makes me so happy. I would like that. What a missed opportunity if you don't. Like, that's awesome.
Stole somebody else's really cool name. Okay. Wow. 15 minutes left. How does this happen so fast? Guys,
Because we're nerdy and
We
we
just
love
nerd out
talking
with this
about
stuff?
Yes.
Okay.
We're so nerdy about it. I love it.
we're going to lightning round. We're going to go through these questions. We'll do I'll read the first 3 and you have to answer. Then you're going to read the next 3 and I'll answer. Okay. Are bone grafts painful?
No. The bone graft itself? No.
That's it. That's all I want to say.
The extraction may not be super comfortable. The bone graft as part of 3-on-6 is not painful.
Do I get stitches?
Yes.
Are the stitches annoying?
Yes. The stitches are going to be annoying. Just listen, I know stitches are annoying. I do everything I can to cut them exactly perfect so that they're as least annoying as possible. They're going to be
No,
annoying.
she doesn't. She cuts them as sharp as possible,
I
little
do,
points. We try to
yeah.
get you.
And then I tell them, you poke this lip really bad. No.
Oh.
No. Stitches are annoying. Stitches are also extremely important. Please don't mess with them. Please don't try to take them out. Just leave them there. Let them do their job. They'll go away on their own when they're ready.
Is cadaver bone unsafe?
Nope. Like I said, in 15 years, I've never even heard of a recall on bone graft.
Or I've never heard of a rejection of a bone graft either. A patient's body just rejecting it.
No, I haven't.
Again,
either.
it's sterilized.
Yeah.
It's demineralized. It can't be demineralized.
It's not demineralized. It's
Can't be that.
If
Freeze-dried.
Tim from Deichlich is watching this right
Yeah,
now, he's gonna be
Tim.
like, "I left you a brochure yes last week."
Okay.
I don't remember what it's called.
Do
but
you
it's not
always need a sinus lift?
No.
In
Yeah, let's see. We've done
5% of the time?
I was gonna say there's
Do we do sinus lifts? Sure. Do we do them often? Not really.
not really.
We do them when we have to.
Yeah.
But most of the time, in fact, patients all the time go somewhere else. They're told, oh, you need sinus lifts and 8 months of
Yes.
healing. And then we'll go back in and do step number 2. And then you need this and that. We do one surgery and
Yeah.
just skip the sinus. We angle an implant forward
Mhm.
and put one in the pterygoid. We skip it. a much more predictable outcome. Okay, you have to give me the next 3. I haven't even read them yet.
Who is your favorite assistant ever, and why? And why is it Tiffany? No, just kidding. All right.
That was really good.
Thank you.
Like a comedian.
I stole that from that patient the
Yeah, that
other
was
day,
actually really
yesterday.
funny.
Who is your celebrity boyfriend, and why is it Ryan Reynolds? All right. You can never get implants if you've lost bone. That's my question.
False.
Oh. This is myth or fact.
Almost
Got it.
every patient has some degree of periodontal disease and or bone loss.
True story. Even me. Even you.
Even me.
PRF is made from your own blood.
That is true.
Mhm.
So at the onset of treatment, right after you're sedated, we draw some blood, we turn it into PRF and PRP in a centrifuge, and we make sticky bone with it, and we use it to accelerate healing and promote good, healthy, hard and soft tissue growth.
Yes. Bovine bone means you'll have cow bone forever.
No. So even if we give you bovine bone, or even if we give you cadaver bone, it's just the initial matrix. And I'm going to use some big words right now. It allows for the osteoblasts
Osteoblast.
to
There they
begin
are.
new
Yes.
bone formation and innervation from the blood vessels and blood supply, and it turns it over. So essentially, it's just a scaffolding and a matrix for your bone to go into and form all new bone and degrade the graft. Ultimately, it will end up being just your bone.
Your bone. That's funny. I actually read it. Bovine bone means you'll have cow bone fever.
Fever?
And I was like, no.
I've never heard of that one.
I did have a patient ask me that one time. And I said, listen, if you start craving like grass, let me know. But I've never heard of it.
You're hilarious.
She's in finals now. She's doing great.
Ooh, you gotta.
We got another question. Curtis.
Oh, Curtis. I have decided to go with the 3-on-6 plus. I'll be reaching out to Tiffany next week for a smile design appointment.
Yay,
It's awesome, Curtis.
All right.
Awesome. Super excited for you.
I wish we had time right now to talk about a 3-on-6 plus, because that is really fun. But there's an entire
Say we have a whole
library of us
video.
talking about 3-on-6 pluses. Well, congratulations, Curtis.
That's
Look forward to
awesome.
helping you. Okay, I'm going to do the next 3. I'm giving you the next 2. Oh, there's 4 of the next section. I'm going to give you the first 2. You're going to give me the next 2.
Okay.
Why does bone disappear when a tooth is removed?
Why does it disappear?
Yeah.
There's just no structure for it. And
Yeah,
so
it
it
just
just
leaves a hole.
slowly, just kind of
You're on
slowly
three.
absorb. Yeah, now you're on 3. It's just lack of structure, which is why you want to put the bone graft there to give it the strength and structure to stay.
Correct. Mia Huff said, I'm jealous. I'm still saving up. Here, we'll make hers big on the screen. Oh my gosh. The one time I tried
Now
to click on one.
Now we're shaking the
Sorry.
world.
I'm sorry. Okay.
Mia, it'll be your turn soon.
We'll get you.
Everybody has a
Instagram
time.
Said, I have a question. Will you just tell them that you would love to answer?
We would
it?
love
Hey,
to
Instagram
answer.
person, I would love to answer your question.
Instagrams.
You want to call me or just want to put it in the comments?
Give him a second.
I will to go with
Put it in the
Mia
comments.
though. She says she's still saving up. We had a patient come in this week who
A
we saw
year?
a year ago,
Yep.
and she's finally ready. Everybody, when it's your time, it's your time, and we're not going anywhere.
We'll be here.
Yep.
We
we're
met
not
her a
going
year
anywhere.
ago. She came in this time. Guys, it was fun. I walked in the room and I was like, hi. I couldn't even say like the rest of hi. And she stood up and gave me a hug.
Yeah.
And she's like, I'm just so glad to finally be back in the
Yeah,
office.
I'm ready for this.
Yeah.
I'm yeah.
It's beautiful.
You also got called an angel sent from God today.
Not today.
Not today. Yesterday by your
Yesterday.
patient's wife who
I
you did
know.
surgery on this week.
And I want you
and-
guys to write that down and remember it.
For the rest of the day, we had to deal.
I'm an angel. You refer to me as angel.
Angel.
Angel
Dr.
Jason.
Let me go get Dr.
Angel
Angel.
Emmet. Okay.
Angel.
Next one. Can everyone get an implant immediately? Ugh. I think they mean an
Everyone
immediate
get an-
implant.
No, not always. You have to have really certain parameters to be able to do an immediate implant.
Yeah.
Um,
That's why I hate words like everyone, all the time,
everyone,
every,
the
always.
definitive, always. Yeah, I got in trouble for that.
Can a
not a
lot
lot
of
of
people get an immediate implant? Yes.
Yes, a lot of people can.
How much bone do you? Oh, sorry. Okay, you give me these 2.
How much bone do you actually need?
How much bone do you actually need? Well, implants come in different lengths and widths. So the shortest implant that we have is
Well, you can get the
short fatties.
the short fatties, and they're like
7.
6s.
Oh, we get down to
they
6.
6s, a 7.
So
7s is usually
theoretically, if you had 7 millimeters of bone height, you could put an implant into it. But For 3-on-6, I like my implants to be 2 millimeters below the top of the bone.
Mhm.
So you really should have 9 millimeters of bone height in order to accomplish that. But we frequently place 15 millimeter implants, and we
18
commonly
millimeters.
place 18 millimeter implants. But every case we do, I place 4, 5, 6, 15 millimeter implants. If
Yeah.
not, I want to place as many 15 millimeter implants as I can,
Yeah.
because that means we had big, strong implant. And if it's 2 millimeters below bone, that's 17 millimeters of bone height in all the key areas. But this is straight up and down vertical. I can also do this with implants. I can angle them and tilt them
Yep.
sideways. So does it always have to be height from top to bottom? No, because I can angle in this way and easily get longer, stronger implants in. So I'd say the minimum you'd have to have is, should we just say 7 or 8?
Let's just say 7.
Okay,
Let's
7.
remember 7.
Because I can still angle that implant
Yeah.
forward too. So
Yeah.
7. Okay, here's
But
the
you're-
big question from the Instagram
My
guy.
Instagram friend said, I have my own teeth, but lots of work. I only have 4 of my own teeth. The rest are fake. Crowns, bridge, and a couple of implants. I want them all the same, and they are getting bad. I want them all out and done correctly. And that's
Great. Call
Cool.
702-710-9006.
Call the office.
Yep. That was all jokes aside, that's common.
Very common. Yep,
I
very,
would
very
say
common.
you fit into a very normal category
Mhm.
of patients that seek out this type of treatment. At some point, it's illogical to keep spending time, energy, and money on your existing teeth
Yep.
when they have reached what we call terminal dentition status. It just doesn't make sense to keep babying them along or band-aiding them along.
Band-aid, yeah. We frequently at our office refer to that as the Band-Aid method. We're putting a Band-Aid on something. It's never going to heal. It's never going to be right again. Like it needs to be removed and replaced, but we Band-Aided along.
Yeah.
So yeah.
Totally true.
I was going to say your patient on Wednesday has 5 12 millimeter implants and 7 15 millimeter
Oh, yeah.
implants.
Because you have photographic memory, and I couldn't remember that, but
12 12 12 12 12
that makes sense.
15 15 15.
I'm sure you're right.
Oh,
I'm not going to challenge
I
you.
know I'm right.
All right,
Okay.
what's my next one?
What happens if you don't graft? Dr. Emmett.
Oh, boy. Okay.
The world falls apart. No, just kidding.
What would happen if you don't graft? You would rely on the body's own mechanism to fill in empty space,
Mhm.
and you could potentially end up with inadequate osseointegration of the implant into the bone because there's not enough surface area of the implant touching the bone. So grafting is a critical component for successful outcomes in 3-on-6 surgeries. If something happened, like I can't imagine what it was. They went to use the bone graft and it was all expired and none of the machines were working and there was a problem and we had to send the patient home without bone grafting. I suspect that you could still have an adequate outcome, but I would be genuinely concerned about the ridge height and the osseointegration of those implants that needed gap grafting.
I do think, how long do we have?
You have 5 minutes.
I do think it's important because we've talked a lot about different types of graft.
Yeah.
We've talked about cadaver, so allograft. We talked about xenograft, which is the bovine, and then autograft, which is your own bone, where you would take it from your lower jaw in different places.
Yeah.
I will say there's been a lot of studies. There's been a lot of published studies about the success rate of these different types of grafts. They all heal the same. There's one.
That is a key. I'm glad you brought that up.
There's one
In this whole research paper, that's
Yep.
what they came up with was
the autograft or your own graft had a higher success rate by like 0.3%.
Yeah. And is a little bit quicker in
Yeah.
healing, but just marginally, not even enough to make it clinically evident or relevant.
Right. Which is what it says. It's not even clinically relevant.
It's yeah.
So yeah, they all are going to heal at the same success rate. They're all going to heal the same.
Yeah.
Yeah, all of that. So I had to do a whole paper about that.
So I want to talk about a few more things about bone graft. We only have a couple minutes left. Tiffany, one of your favorite things to do at the 4-month appointment
It is my favorite thing to do at a 4-month appointment. Absolute favorite thing to do.
is what?
So when we take your bridges off at your 4-month appointment to test your implants, make sure everybody's happy and healed. Your gum tissue has healed beautifully 99.9% of the time, right? It's healed gorgeous. As it heals, it kind of encapsulates bone graft particles a little bit. So when we take your bridges off, there'll be these little particles of bone graft. And if you had told
They look like
me-
sand.
They look like sand. They look just like we showed you in the
What
jar.
we showed you in the jar.
If you would have told me that my favorite thing to do at work on a 4-month appointment is to pick those out of your gums, oh, I love it. It is
You're so gross.
so satisfying. I love it. It's not painful, by the way. I've never had a patient go, oh, that hurt. Like,
No.
it's just little tiny pieces. And when I look down, and it's just perfect pink gum tip. Oh,
We tell
my
people
favorite.
while you're healing, you might have little bits of sand in your mouth. You might feel that. If you do, if you swallow one, it's not going to hurt anything.
Not gonna do
You can
anything.
spit it out.
Yeah.
But it is just little grains of sand, and they just tend to work themselves loose a little bit out from underneath the bridge, out from underneath the membrane. And that's totally normal. And they heal up into the gum tissue, and then
Oh,
Tiffany
I get to
removes
pick it
them
out.
so that they don't cause you any pain.
Well, and also remember that the really, really important graft is down in the sockets.
Yeah.
It's down under the bridge. The little bits and pieces that you see,
It's
it's
the extra.
okay. It's
Remember,
the
I
extra.
overfill it by
Yeah,
20%. It's the extra stuff.
Yeah, you don't need to panic about it.
We have
So,
one last question. Last question of the day, and we're going to sign off. So you snuck in. Who is this?
Oh, she comments on our
Ashia.
stuff
Is
Uh,
it Ashia? Ashia.
Miss
What?
Connerly. Mrs. Connerly.
Miss Connerly.
What if your gums are short? Oh, can I have a marker? I'm going to answer this, and no, give me a highlighter.
He-
Give me a different color.
He wants the purple
Listen.
expo.
I don't care what color.
Oh,
You really can't have short gums, and I'm going to explain what this means. Almost now, people can have thinner gums. People can have a very thin type of gums, and we have patients have thick gums and kind of thin gums. But what sets the bone or the gum height? Let's say that this is your gums here. It's the bone. Your bone and your gum tissue go together. So if you lose bone, your gums will follow it. So if you look in your mouth and you can see the roots of your teeth, or you think, oh, I've got short gums, that's actually a representation of your actual bone height. So the maximum bone height the maximum soft tissue height that I've ever seen on top of gums that is stable and healthy is 5 millimeters. The biological width, according to the textbooks, is 3.24 millimeters. I know this sounds very specific, but stay with me here. So if you have periodontal disease
Yes.
and you have your gums are inflamed, that causes the bone to recede. And as the bone recedes, the gums follow it and chase the bone.
Yep.
That's why it doesn't stop until you eradicate the disease,
Periodontal disease.
right? So you really don't have short gums. If you have areas where you're noticing that means we have some bone loss. That's a great indication to get the disease process stopped, right? Eradicate the periodontal disease, stabilize the bone grafting, and an implant, and get a new lease on life in that area. Because once we get you new, good, stable bone, and we set your gums on top of it, we can regain the height.
Mhm.
And then as long as
Why
you
we bone graft.
keep it healthy, it'll stay exactly where we put it at.
Okay, she has one more
can you-
question.
Yeah.
No, you get one question.
One question.
It is
per live.
12:59. Does bone
Does
graft
help stop implants from failing?
every day?
Mhm.
Every day.
Yep.
Bone grafting is critical. The implant is here, the bone is out here from the extraction, and there's a gap in the middle. How do we get this implant as stable as possible? We gap graft this whole area with good,
Add a
healthy
bunch of
bone,
Mhm.
and then your body will infiltrate into that scaffolding and build good, new, healthy bone, and let that implant osseo integrate.
Oh, we love you too. She said.
Mrs. Connolly.
I'm gonna put that on there. That's
Yeah, that's how we're going to end the day.
That's how
We
we'll
love you.
end.
Love you.
Love it.
Guys, thank you so much for watching today. This video will be live
On YouTube in about 5 minutes.
in 5 minutes. It's on YouTube. You can always go back and watch it there. And if you have,
And who are you?
oh yeah, I'm Dr. Emmett in Las Vegas at All Out Dental. I'm the Keep Your Gums guy. Keep Your Gums with Dr. Emmett. If somebody wanted to call our office and get a free, even a virtual consultation, how can they do that?
We do lots of virtual consultations.
Tons.
You can call the office at 702-710-9006. Also, just for funsies, follow us on all these platforms. Bailey's
Follow us
working.
there.
Bailey's working so hard
Really
on all our
hard.
platforms. Follow us
4.4
on
million viewers. I mean, that's a big deal.
That's a huge.
4.4 million
yeah.
views
Yes.
of me
So-
talking about teeth. Boring. Bye, guys.
People
Have a great
love 'em.
weekend.
Thanks, everybody.
See ya.
People love you. your boring videos.
So boring.
I love that you explained a biological width.
I know.
Okay, so biological width.
I never want to go like in too much like nerd out detail, but that was a good